Congressional Budget Office was out with a report Tuesday looking at the budget impact of the Supreme Court's decision last month on the health care law. We've got Louise Radnofsky in Washington to help us figure out what this means. A lot of numbers here. But Louise, is the CBO saying that taxpayers are going to win or lose after what the Supreme Court did?
Well, it depends what you mean by win or lose. The bottom line is twofold. There are 3 million fewer people who are going to have insurance as a result of changes to Medicaid, but it is going to cost less as well, around $84 billion less in total. That's a little bit lower than people were expecting, because actually more states are expected to opt out of Medicaid, saving the federal government $289 billion, but it's going to cost about $200 billion to insure some of those folks through exchanges instead, where they'll get credits instead of being enrolled in a full-blown federal state government-run insurance program.
At this point, do we know how many states will opt into or opt out of the increased Medicaid provisions?
We don't. We know that at least 7 governors have strongly signaled that they intend to. What the CBO did was that they didn't name or go through specific states, they say. They simply tried to divide them into broad buckets, essentially based on incentives and disincentives, and make a guess. Now, whether or not they actually did that is a different matter. It seems as if their numbers line up quite closely with those that other groups have done when they did go through this on a state-by-state basis.
And of course, whether or not they go for full coverage or they go in really affects the cost to the federal government then.
Right, and a lot of this is still being written now. You may remember that the Medicaid decision was actually something of a surprise to a lot of observers. And what the federal government is doing now is looking at the system that they've been left with. They're trying to draw rules to answer a bunch of questions that states have, like whether or not they could partially opt in, whether or not they could opt in late, whether or not they could opt in early but opt out later. A whole number of variables that the CBO mentions in its report as being reasons to treat these estimates with caution, because they could very well change in big ways based on dynamics we don't yet know about.
Right. I think we just said if we can get back up on screen, maybe there we have the coverage calculations, and you see some of the differences there between what the original estimate was and the revised estimate after the Supreme Court's decision, and how some of those numbers are coming down. All right, Louise, I guess last thing is, had the Supreme Court scrapped the law altogether, would that have been less of a strain on the budget, or would it have cost even more?
Well, the best way that we can look at this is through a bill that was passed by House Republicans a couple of weeks ago, repealing the law in its entirety. When CBO scored that, they said that it would increase the deficit by $109 billion over the period that it was looking at. That's because while there's a price tag, a very big price tag, on the cost of expanding insurance coverage, even now with the changed Medicaid plan, it's about $1.168 trillion. There are also revenue-raising taxes and some spending cuts that come to a greater sum than that money.
All right, well, the economics of this is indeed complicated, but you've helped cast some light on it. Louise, thank you very much.